Inflammation is a hallmark of chronic health conditions, including autoimmunity, and C-reactive protein is a marker that can reveal if you have inflammation. This is Dr. Eric Osansky, and in this video, I'm going to discuss what can cause an elevated CRP, and I'll discuss what you can do to decrease your CRP levels, including some nutrients and herbs that have been shown in the research to lower CRP. Before I begin, I just want to remind you that the main reason I put together these videos is to help people with different types of autoimmune conditions and other health issues better understand the test results so that they can find or remove their triggers, correct any underlying imbalances, and feel great again. So let's start off by discussing what CRP is. CRP is a protein that's mainly synthesized in the liver, although it's also produced in smooth muscle cells, macrophages, endothelial cells, lymphocytes, and adipocytes. CRP is an acute phase reactant. Acute phase reactants increase or decrease in response to inflammation. Interleukin-6 is a pro-inflammatory cytokine that stimulates the liver to produce CRP. So high CRP levels are associated with inflammation, although it's important to know that having a normal CRP does not rule out inflammation. Next, I'd like to discuss a few things you should know about CRP. First of all, CRP does not have any diagnostic value, which means that you can't diagnose any specific health condition based on an elevated CRP. It's also important to know that autoimmunity is associated with inflammation, but CRP isn't always elevated in autoimmune conditions. In fact, I see a lot of autoimmune patients with normal CRP levels, but this doesn't mean that they don't have any inflammation. You also should know that an increased CRP is associated with an increased risk of cardiovascular disease, and the reason for this is because inflammation is a key mechanism in the development and progression of atherosclerosis and other cardiovascular events. CRP has a half-life of approximately 19 hours. Because of this, when the inflammatory trigger is detected and removed, CRP can rapidly decrease. When testing for CRP, you always want to test for a high sensitivity CRP or hsCRP. I'd like to briefly list some of the different factors that can cause an increase in CRP. Since CRP relates to inflammation, everything I'm about to mention can obviously increase inflammation. Certain infections can cause an elevation of CRP, as can trauma, malignancy, an allergic reaction, sleep deprivation, as well as certain oral contraceptives. Of course, this list isn't all-inclusive, as there are other factors I haven't mentioned which can cause an elevated CRP. Let's go ahead and take a look at the reference range used by both LabCorp and Quest Diagnostics. So low risk would be anything less than 1 milligram per liter, average risk between 1 and 3, high risk greater than 3, and then an optimal reference range, again, would be less than 1 milligram per liter. Let's take a look at some reports. So here we see that C-reactive protein is slightly high at 3.29. Here it's a little bit higher, 6.10. And then CRP on this report is 9.44, which of course is even higher. And here it's quite high at 14.64. And I've seen even higher levels than this. So what can you do to reduce CRP levels? The first thing you should do is think about some of the reasons why you might have inflammation, and then you might need to do some detective work to find the cause. Of course, if your elevated CRP is due to a recent trauma, then it might resolve on its own after a few weeks or perhaps a little longer than this. If you have no idea why your CRP is high, then some factors to consider are food allergens such as gluten or dairy, having some type of underlying infection, and certain chemicals can cause a high CRP, including medications. If you're eating a lot of refined foods and sugars, including a lot of foods with gluten and dairy, then cleaning up your diet is something to consider. Improving your stress handling skills may or may not help with elevated CRP levels, but either way it will benefit your overall health. On a previous slide, I mentioned that sleep deprivation can be a cause of elevated CRP levels, and so trying to get better quality sleep of at least 7 to 8 hours in duration is something you can work on. Having a healthy gut is important in order to minimize inflammation, and so you might want to follow the 5R protocol, which I've mentioned in other videos. These are the 5 components of the 5R protocol. Decreasing your toxic load may also help, and you can do this by eating a healthy diet consisting of plenty of vegetables, preferably organic, drinking purified water, and doing other things to help with the elimination of chemicals from your body. According to the research, there are numerous nutrients and herbs that can help to lower CRP levels. This includes fish oils, curcumin, vitamin D, vitamin C, ginger, rosemary, resveratrol, certain probiotics, and green tea. There's a question mark near green tea because there are conflicting studies. Some show that green tea can lower CRP, others show that green tea has no effect on CRP. Of course, either way, green tea is a good source of antioxidants. While taking supplements may help to reduce the CRP levels in some individuals, you of course need to find or remove any triggers that are responsible for the inflammation. For example, if someone is eating inflammatory foods that are causing the CRP to increase, then just taking supplements probably won't help much. And the same thing applies if someone has an infection that's causing the CRP to increase. Having healthy vitamin D levels is important for combating inflammation, and I put together a playlist which has a few different videos where I discuss the best tests for vitamin D, including the optimal reference range, and how to boost your vitamin D levels. And if you want to receive more videos like this one, please click on the subscribe button below, along with the notification bell, and I'll catch you on the next video.